Welcome to Medics in Minutes. So, this is the spinal needle. Before going into details, let's identify the parts of this spinal needle. Basically, there are two parts. This spinal needle and the introducer. So, all are covered with a sheath. You can see for the protection. First, let's talk about this introducer. This introducer has a transparent part and a metal needle, which is usually 22 gauge with a sharp point which can pierce the ligaments and structures before reaching the subarachnoid space. So, because this is too sharp and strong, we don't pierce the dura with this needle. So, if we accidentally go through the dura with this sharp and 22 gauge needle, it can cut the fibers of dura and can cause CSF leak. So this patient can have a very bad headache because of CSF leakage. Let's talk about that headache in another video. And this is the spinal needle after removing the sheath. You can see here. It has two parts. This is the stellate and this orange color is stellate hub. You can identify the gauge with this stellate hub color. This is 25 gauge one. There are 23 gauge and 27 gauge like things. Usually 27 gauge we use with combined epidural needle. So this is the one that we usually use, 25 gauge one. It also has this transparent button, a small needle which is the epidural needle. So the specific feature of this spinal needle is this point is less traumatic and not sharp, and the opening is not at the end, it's in the side. This is, we call it as the side orifice. You can see here, it's very small, you can barely see it. So this tip also less traumatizing. We call it pencil point tip. You can see it in this picture, the side orifice and pencil point tip. So after we introduce this needle to the dural space, we can give spinal anesthesia. We can do a lumbar puncture for diagnostic test for to take CSF. It does not cut the fibers of dura. So after taking this out, it usually the gap closes and prevents CSF leak. That's why we use this for lumbar puncture. So this needle is usually 88 millimeters long. It means 8.8 centimeters. So some needles are there like 120 millimeters, like 12 centimeters long. We can use them in like very obese people because we can't reach the dural space with this kind of length. So we can use 12 centimeter needle for that. And I said we don't pierce the dura with this introducer. It usually goes up to interspinous ligaments. So I think you should know the layers that we punch, pierce with these needles. So first we go through the skin, then subcutaneous tissue, then supraspinatus ligament, interspinous ligament. Okay. After that, this goes through the interspinous ligaments and ligamentum flavum, and finally the dura. After punching the dura, you are in the subarachnoid space. So if you remove this stellate, you can see clear CSF coming through this needle to this transparent part. If you are doing this for a lumbar puncture for diagnosis, you can collect CSF from here. If not, if you are using this for giving spinal anesthesia or subarachnoid block, you can give 0.5% heavy bupivacaine according to the patient's size, weight, and height. You can give bupivacaine with this needle. I think that's all you should know about the spinal needle. Thank you for watching. Please subscribe and share. Let's meet with another video.